Have you ever known someone with OCD or wondered if you yourself had OCD? OCD is a term that's thrown around quite frequently today, but few people really understand how it works and when it's a problem and really, frankly, when it's not a problem. So in today's episode, we're going to look at the hidden anxiety mechanism that is embedded in OCD and how we can keep an eye on it so it doesn't mess with our emotional intelligence. Hi, I'm Dr. Greg Hamlin. Welcome to the Steps and Tools podcast. Today we're going to look at obsessions and compulsions. What are they? How do we distinguish them from some other things? What kind of variety do they present themselves as, and what do they do with our emotional intelligence? First thing to understand is that obsessions and compulsions are not necessarily bad. An obsession is a repeating thought that you just cannot get out of your mind. It just goes over and over, and you cycle. Even when you don't want to have it, it keeps going. An example of an obsession would be a music melody, a song that you just keeps going over. That would be an obsession. Thinking about somebody's flaws or some particular mistake they made and going over and over it in your head, that's an obsession. Certain types of worries are obsessions because they go on, and you feel helpless to stop them. A compulsion, on the other hand, is not usually a thought. It can be, but it's usually a behavior that someone engages in to relieve the anxiety of the obsession. So the classic example would be, a 10-year-old boy has OCD, and his type of OCD has to do with germs and cleanliness. So he obsesses about germs and contamination a good part of the day. And because he's worried about germs, he washes his hands and he cleans excessively. That's the compulsion. The thought would be his thinking about germs, his worry about germs, and the compulsive behavior would be the washing. So what happens is that as a person thinks about something that they're worried about, they obsess about it, their anxiety response in their body gets ramped up, and as the anxiety increases, you start looking around for relief. And that's where the compulsion comes in, promising to give you relief. But it's a trap, because the relief that it gives ends up cinching the obsession tighter around your neck so that it's more a part of how you think. So every time this boy washes his hands, he feels a little bit of relief, which reinforces the behavior, which makes him all the more determined next time that he worries about germs to wash his hands again. And so he may wash his hands 60, 70, 80, even 100 times a day until his skin on his hands is bleeding. So that's a simple example. It's a somewhat common example because the washing and cleanliness obsessions are among the most common. But obsessions and compulsions can be good. For example, if you're in a burning building, you smell smoke. You begin to think about nothing else than getting out of that building. You're obsessed with the idea of getting out of that building. You're obsessed with the danger that's confronting you, and the compulsion is to do everything possible to get out of the building. So that's an example of where it works well. And in general, we could say that whenever the reality of the situation fits with high danger and the need for immediate action, obsessions and compulsions can work for you rather than against you. The problem is that most of the time people are not in imminent danger, and they're obsessing about things that really are not about to circle in on them. So it becomes very disruptive to their lives. Now, OCD has various intensities. So But and I should back up here, because when we say obsessions and compulsions, we're not necessarily talking about a disorder. We're talking about just a phenomenon of the human mind, where we obsess and we think about things repeatedly that we're concerned about, and then we act compulsively to find immediate relief to those obsessions. But when there's a pattern where this happens hours out of every day, and it starts disrupting life in a whole host of ways, then that's when we talk about it being a disorder, and that's what OCD means: obsessive compulsive disorder. And it comes in many forms, and many psychologists and mental health professionals who work with this sort of thing don't always agree with the way certain disorders are classified according to the diagnostic schemes. For example, something like bulimia is classified as an eating disorder, but it really follows the pattern of an obsessive compulsive disorder. You know, a person thinks repeatedly about and worries repeatedly about whether they've eaten too much, and then the compulsion is go purge that, go make themselves vomit, or go exercise at the gym for 4.5 hours straight. So many people would argue that bulimia is a form of OCD. Another common type of anxiety that's not always thought about as OCD is health anxiety, or hypochondriasis. So if somebody is a hypochondriac and they're always worried about this ache or pain, or they take some blood test at the doctor's office, and then they're obsessed with getting the results back. They're just sure they have cancer, even though there's nothing that would lead them to believe that. This kind of health anxiety often takes the form of OCD. A person obsesses about some symptom, some sensation, and then they engage in some kind of compulsive checking behavior in order to get reassurance, or to verify that they're okay. And that cycle can go on, and it can consume a person's life. Now, as with so many things, when we're confronted with extreme examples, it's not very difficult to see that it's a problem. It's more difficult to identify the milder forms of OCD that may be messing with your effectiveness, your success, with your relationships in ways that are not crystal clear, but only come to the surface when you just take the time to analyze them and look at yourself clearly and courageously. Now, there are many different types of OCD. The most common type, as I mentioned, is the washing variety, where people are concerned about germs. The obsession is about what if I have some germ on this towel, or some bacteria on this towel that's going to infect me? I'm better just wash again to be safe. That's the compulsion. Another very common type is the checking variety, and that's when people obsess about some type of safety. Is the window closed and locked? Are the doors locked? Did I turn the oven off? So there's some kind of, and the person usually imagines some catastrophic danger that they associate with failing to do something, and the compulsion is the checking behavior in order to reassure them. Now, most people have had the experience of driving away from their residence or where they live and wondering, did I turn off the stove? And having that and being obsessed with that on an occasional basis is not OCD. That's just the way anxiety works in the normal human beings. However, when a person is doing this repeatedly, and they check all the windows in the house because they're afraid of intruders, and then they check again, even though they remember checking before, and then they check a third time, then you can see how this starts to grow into a monster, and it starts to displace a lot of really important energy in your mind for just thinking good things and accomplishing things, and even listening to other people. Another very common type of OCD is what is sometimes called the just so or perfectionistic OCD. And it really has to do with things like symmetry, things lining up, or it may not be. It may just be the kind of thing where somebody has a very rigid, detailed idea of how something ought to be, and they can't stand it if it isn't in that pattern. Examples might be of a picture that's crooked on the wall. That would be a simple example. Somebody with OCD of a just so OCD, they have a hard time sitting in a friend's house while the picture on the wall is crooked. They might white knuckle through it and resist the compulsion and the urge to get up and straighten it, but it does affect their ability to actually enjoy the event and be in the moment. So these are three really common types of OCD. There are others. There's counting, where people see numbers everywhere and they see patterns of numbers. But what they all have in common, and this is the key point here, is that they all have in common this hidden anxiety mechanism. And it goes something like this. The obsessive thought raises a person's level of anxiety and distress. They feel on edge, they feel tense. It may not be noticeable to anyone else, but their anxiety level is going up the more they repeatedly think about this obsessive thought. Then the compulsion presents itself in their mind as a solution to get rid of all that uncomfortableness, all that anxiety, all that tension. So it could be, I'm worried about the windows not being locked, so I go check them yet again. I'm worried about germs, so I wash yet again. I'm worried about things being just so on my desk or in the room, so I go around and fluff the pillows and straighten the pencils on the desk and that sort of thing. And it becomes a way, in all these cases, the anxiety mechanism you can think of an arrow going up for the obsession and an arrow going down for the compulsion. Compulsion gives the relief. And the tricky thing about this anxiety mechanism is that the relief that it gives is like a popcorn ball with a fish hook inside it, because it feels oh so sweet and tastes oh so sweet at the moment, but it ends up solidifying the power of that obsessive compulsive pattern more deeply each time you use it. And that's why nearly all treatments for OCD involve some kind of therapy called behavior therapy, where people find different ways to resist the urge to follow through with the compulsion, because that's how you break the pattern. And that's a whole nother topic in and of itself, just how to do that and how to make it, how to pace it out so that you take it in bite-sized chunks. Now let's talk for a moment about what OCD does to emotional intelligence. There are many factors in emotional intelligence. There's things like self-regard, self-actualization, emotional self-awareness, your perception of yourself. Oftentimes, OCD can make a person feel less than because they feel out of control. They feel like they have to give in to these compulsive urges. It certainly can affect their self-expression and how well they communicate, because this worry is always in the background. It can affect their relationships because, for one thing, they're not good listeners oftentimes because they're distracted. They're distracted by their own obsessive thoughts. They're also have trouble a lot of times making decisions, and actually this can become a whole type of OCD in and of itself. One of the key areas of emotional intelligence is good decision making. Being able to assess a problem realistically, to know how to solve the problem, and how to control your impulses so that you can implement the solution. But it's oftentimes people with OCD will obsess about making the perfect choice. So they presented with, it could be a a young adult who's been accepted to 2 different colleges, and they see the benefits of each one, and they can't make a decision because as soon as they start to settle on one choice, the anxiety and worrisome thoughts about what if they're missing out by not going to the other one, those obsessive thoughts circulate in their mind over and over and over. And the only way they can relieve that finally is to compulsively say, well, I was wrong, I need to go to this college. And then the whole cycle starts over again. They bounce back and forth. It can be something like a big decision, what job, what college to go to. It can also be something as simple as ordering items from a menu at a restaurant where you can't settle down and make a decision because each time you get close to making a decision, your obsessions kick in that maybe you're making the wrong one, and then to relieve that anxiety, you have to look at something else. So, hope that gives you an overview of how obsessions and compulsions work. It's really a good thing to be focused, and a lot of times people with mild OCD learn to harness it so they can latch on to certain goals, and they can be very successful and tenacious at reaching those goals. But there's usually always a downside, and it's important to have enough self-awareness to realize when to be able to back off from obsessions and compulsive behavior, because otherwise it will damage key relationships in your life, and even more importantly, it just takes away the joy, it takes away the happiness and the sense of well-being and the calm in life because of this underlying anxiety mechanism. So thanks for listening, and I hope this increases your awareness of OCD. And until next time, I'm Dr. Greg Hamlin.